Hi Josh, my name's Christina. I'm going to be doing an exam of your chest and your heart today. You feeling okay today?
Yeah.
Good. You look good. First thing I want to do is just kind of inspect your chest, inspect configuration of your thoracic cage. Looking for symmetry. I'm looking to make sure that the muscle tone is good, that the alignment of your spine is good, and that you don't have any abnormalities noted. Skin color is nice and warm pink, perfect for your genetic makeup, and scapulas are both symmetrical. Muscle tone is good. Next thing I want to do is I want to just palpate the expansion of your lungs, and what I'm going to do is I'm just going to kind of push the skin together by my hands bilaterally placed, and I want you to take a deep breath. Good. Normal expansion. The next thing I'm going to do is I'm going to be listening for fragmentus, and I'm going to just be tapping in 9 different locations on the back. I'm going back and forth. So I'm probably not going to go all the way down, but normally what I would do is I would do 8 locations on here and then on the sides. So what I'm listening for is a resonant sound where I'm just basically hearing this tapping on your lungs. If I happen to get over a bone or an organ, then it's going to be a dull sound. And then the next thing I want to do is I want to check for any tenderness, any areas back here that you're sore, or muscle tenderness. No masses noted. And then the next thing I want to do is I want to listen to your lungs. And I'm going to do 9 different locations listening to your lungs. So I'm going to listen to your breath sounds. I'm listening for any wheezing, any bronchi. You have asthma?
Yeah.
No, I'm not hearing any wheezing though.
That's good.
Good and nice, good, even breath sounds. And I'm hearing it equally on both sides. Okay, the next thing I want to do is I want you to whisper 1, 2, 3 in just a really light whisper. Again. Good, just as it should be. I'm not hearing it. The next thing I want to check is for bronchophy, and I want you to say 99.
99.
Good.
99.
And we're wanting to hear a soft muffled sound, and that's what I'm hearing. The next thing is I want to listen for is egophony, and I want you to say a long E.
E.
Good.
E.
Good. Okay, next thing we want to do is move on to your heart, and we're going to be listening to your 4 different valves, the aortic, pulmonic, tricuspid, and mitral valve. And then I'm going to be using the bell on my diaphragm on this one. So I'm going to look for my landmarks, suprasternal notch, and then I'm going to go down to the second intercostal space on the left, on the right. And I'm going to listen to your aortic. And then the pulmonic on the left. Then we're going to move down to the 5th space. And I'm going to be listening for your tricuspid valve. And then I'm going to move over and listen for your mitral valve. And I'm hearing a regular heart rhythm. And the next thing I want to do is count your apical rate. And what I want you to do is time me. I would be timing for a minute, but to save time for the video, we're going to go 30 seconds. But to get an apical rate, you want to do a minute. getting 40, which would be 80 beats a minute. And as of note, which is common for your age, when you take an inspiration, your heartbeat speeds up a little bit. The next thing I want to do is I want to just palpate your carotid, the carotid line just right underneath and medial to your sternomastoid. And I'm not wanting to push too hard. And then I want to use my bell and I want to auscultate the same carotid in 3 locations, just right under the jaw and just medial. Listen for any bruise, any whooshing sounds, and then just down here at the base of the neck. Josh, I think you're in good shape.
Okay.
Thanks for your participation.